Now, let's get on to your new invention. If only there was an alternative to
Well,
alcohol.
that's a good idea. Have you got one, John?
Oh, I've got several, yeah. So you kindly sent me some. Now, I have no commercial interest in this at all. The reason I'm doing this, David, is I consider the Bacchus to be quite a wild, raving animal that goes around tearing people apart. You know, alcohol is a real problem, and that's what I want to. That's why I'm highlighting this. But you've invented this stuff. So there's the red for relaxation, and this smells like nothing I've ever smelled before. And I had that one with a ginger beer, I think. Then there's the yellow, which
The gold, we call it, John. The gold.
The gold. Yes, of course. Yeah.
It's our Prosecco equivalent. It's the summer citrusy drink.
Yeah. I'm not so sure about the black. I've only tried that once, but my son and my wife both really like them. So on a small sample size. So what the heck is this stuff, David?
Well, the drinks you're talking about are called SENTIA. They're SENTIA red, black and gold. They're 3 different flavours, but also have slightly different ingredients. But the core of them all are herbs that enhance the effects of GABA in the brain. So SENTIA is designed to mimic a drink of alcohol.
And I must say, I was amazed. I drank this, and I felt like I'd had a double gin, but there's no alcohol at all in it.
0 alcohol, absolutely. It's just herbs, which we've known historically from Chinese medicine, Ayurvedic medicine, and also, interestingly, historic British herbal drinks, which have been designed and used for centuries to relax people. And that's what we want to achieve. We want to give people a drink which can relax them, like alcohol relaxes them, but without turning on the dopamine, the endorphins, without blocking the glutamate. So this is a drink which targets just GABA.
Now, if these drinks artificially stimulate GABA, surely that's going to reduce the amount of GABA that my body produces, like a benzodiazepine, or am I wrong about that?
No, it's a really important question. And it's one that's, we get asked a lot, and we've obviously thought a huge amount about it. And the way we minimize that is this. We minimize it, firstly, by the herbs in SENTIA you cannot get drunk on. Even if we recommend 25 ml units, we recommend no more than 100 mils a day, because that fits within the recommended daily allowance for the herbs. But even if you were to drink a whole bottle, you wouldn't get drunk. So the compensation in your brain wouldn't really kick in, because you're not messing with your brain that much. And the other way we mitigate sort of development of tolerance is because it doesn't hang around as long as alcohol. And so there's less time for the brain. There's less need for the brain to adapt, and there's less time for the brain to adapt. So we're generally not... we haven't had anyone report to us that they, for instance, get disrupted sleep in the mornings like you would if you were getting tolerance to alcohol.
But, if you take... I mean, I'm not saying it's the same as benzodiazepines, but if you take benzodiazepines regularly, then you stop. Your anxiety will be worse than it was to begin with, because you're altering the GABA. I mean...
Yeah.
Is that? Are you fairly happy that that's not a risk here?
Well, firstly, it doesn't work on the same site as the benzos. That's right. The first thing, and the second is that we do know there are benzos which are only used in anaesthesia. Well, you don't get tolerance, because if you just knock someone out for 10, 15 minutes, the brain doesn't adapt. The ones that if you're taking something like diazepam or chlorodiazepam epoxide for 5-6 years, your brain will adapt. The long half-life ones cause more adaptation, because the brain they're always sitting on the receptors. But we're deliberately we're minimizing the time that we're changing the GABA system. And as I say, SENTIA doesn't work through those mechanisms anyway.
I mean, if I took this, and first of all, you get some effect virtually straight away, I must say. It's a very similar to alcohol effect, pleasant. So it presumably must be going through the mouth somehow, because within seconds I could feel some sort of.
Yeah, that's right. I mean, it's quite a lot of herbs in there. I mean, some people think they love the taste. Some people are not so sure, but it definitely stimulates both your sense of smell and your sense of taste, and those nerves feed straight in to your brain centers, where you gauge liking and appetite. So so you're beginning. It's like turning on it's the same circuit as you turn on if you were sipping your first sip of your favorite ale.
But you could still drive home.
Well, we say this. We say if you're feeling changed, and you could be quite relaxed on Sentia, then you shouldn't drive. If your mental state is not as acute as it should be for driving, you shouldn't. But we're pretty confident the effect will wear off a lot faster than if you got to the same level of relaxation with alcohol.
Yeah, I mean, I must say I found the taste extraordinarily. It's unlike anything I've tasted before, but in a very positive way. My wife absolutely loves. Which one does she like? She likes the red one. Yeah, my son quite likes. Yeah, my son quite liked the yellow one, the gold one. Sorry. Yeah.
Old one, yeah. So it's interesting. People vary, and that's one of the reasons we've got these very different drinks. Because there are some people say, I hate the black, and others say, I love the black. And it depends on whether you like spicy things, you want to be, you want to, or whether you like relaxing things. So the red's for relaxation, sitting down with your wife over a meal, or and then the gold's for when your son and all his friends come around for a afternoon party.
Yeah.
And the black, the black you can use. The black goes very well with things like Coke or ginger ale. It's a spicy, activating drink. Yeah. But they all relax you. I mean,
they do. It's quite extraordinary.
But it took a long time to get there, John. It's about 6 years of research.
Were you and your wife in the kitchen jiggling around with different herbal preparations?
No, I was doing it with some sciencey friends who work with us.
No, it really is. Personally, I think the taste is fantastic. I mean, I'm sniffing this. It smells like walking into a. So sometimes in Asia, you get like shops where they sell herbs and spices and all sorts of stuff.
Exactly.
That's what it smells like.
We've had Indians say, "Wow, this is great. I remember drinking this when this is what my granny used to give me this when I was a kid. It's almost medicinal, and so it uses, and of course it uses herbs which have positive effects, and people remember positive effects.
Is it potentially addictive?
I don't think so. I mean, I'll say that for two reasons, John. I'll say that for two. The first is, I don't think you can get intoxicated enough. And the second is, and perhaps this is a more important thing, many people have said to us, well, I'm an ex-alcoholic, should I drink it? And we say, well, we certainly couldn't recommend it, but, if you do choose, let us know. And many of them have said, I chose, I did, and actually I enjoyed it, but it didn't bring back any alcohol craving, because it's not like alcohol. Alcohol craving is through something more deeper than GABA. It's through glutamate or dopamine or endorphin.
So this is GABA, it's not endorphins, it's not dopamine, it's not glutamate.
Correct.
Yeah, because I must say, if I drink a double gin, which I don't really do anymore, but if I did, I think, I'll just have another.
Yes.
But with this, I didn't.
Exactly.
I didn't. I thought, that's quite nice, and then it wore off after about. I think I must say this black one. This seems to work slowly, but I could feel this for about 3 hours, maybe 3.5 hours. This one, the gold, seemed to work really quickly, but not last as long. I mean, it's probably just me, but.
Well, it probably is just you, but it's partly the aromas too, and the taste. And black is a spicier taste, and I think for some people, that isn't what they're used to getting in a drink.
But the idea that you could go out on a social occasion and have this as an alternative to alcohol I think it's a really good idea. Over time, with mass production, it is relatively expensive at the moment. Now, you only need 25 mils at a time, so it lasts for a while. Yeah. Do you think with mass production it will get? Because there's no doubt in my mind this is going to catch on.
Well, I hope so. The way forward is
will it get cheaper?
Well, it'll get different, Sean. And it'll get different in two interesting ways. So if you're interested, at the end of this month, we will have available a beer and a stout. Alcohol-free beer, alcohol-free stout, that has in it the ingredients that give you the effect. We're calling it GABA. And if you'd like, I'll send you.
Please do. Yeah, please do.
So that'll be a lot cheaper. And then the next way, the other approach we're working on is to make it in a can, so people can have a pre-made can. You would have maybe the red and tonic, and that'll bring the price down, so people won't have to have a bottle sitting there. They can just buy a can.
Such a good. I mean, with not drinking, I'll maybe go out for a meal, or go to Witherspoons or something, and you can have some juice and a tonic and some water, but it's not quite the same as a drink. Whereas this is much more like a drink.
Well, it is a drink, and we call it. I mean, much as I don't want to be remembering what Tony Blair said, but it is the third way. You can see on the bottle they've got 3 dots, so it's not alcohol and it's not non-alcoholic. It's functional. Yeah. It's a functional, alcohol-free, functional drink, and we think people should. Well, we know people want it. Yep. We think people should be allowed to get it, and we personally we're thinking of starting a kind of campaign to. It would be nice if any social events which are put on by government funded, local authority funded councils and that, any taxpayer funding, we think it should be a regulation that this is available, because there's a lot of people won't go to those events if because they don't want the alcohol, and that's all that's served. So we think people should have a right to choose non-alcoholic functional drinks.
Sometimes you're walking down and you think, I could just go into that pub for a fish and chips or something. But I don't want to drink with alcohol in it just now. I don't want to drink with sugar in it just now. And I don't want to drink with artificial sweeteners in it just now.
Yes.
Whereas, what's this beer called?
GABA.
GABA.
I'm going to send you a bottle. Don't worry.
I'm salivating already. It sounds great. Well, can you see? You have to send a couple because my son will want one as well.
I will definitely. I'll send you.
It's interesting.
3 steps.
My wife's had a few, but the last we haven't drank much. But after a couple, last night she said, "Oh, I'll just have another one of those."
Well, I'll tell her. You can tell her what I do, which is in the week, I just drink SENTIA.
Right. And
at the weekend, I might have open a bottle of wine and have a glass on a Saturday and a glass on a Sunday. Yeah. But in the week, I find SENTIA is perfectly adequate, relaxes you, improves your sleep, no hangover, and also it's got fewer calories than alcohol too. Yeah,
interesting. Right, so the way forward, there are way forwards. People will always want some kind of escape. I think to deny that is
Precisely, John, precisely. The idea that why would you want to live your life without relaxing if there was a safe alternative? It makes no sense at all.
Absolutely. Can you buy it in local shops? I've never seen it. Your mates kindly sent me these samples. So
it's technically it's actually quite difficult to sell things in shops because you need. So we tried that. We actually tried to and sell it in bars and things, but you need a huge sales force. We're a tiny little company. We've just so now it's just basically it's all online because that's the only way we can afford to survive. At some point we would like to get it into shops when it's become more popular, but at present, it's really word of mouth. And actually, that's one of the nice things about talking to you, because I know you've got a lot of listeners.
I have some amazing people on the channel. That's I don't think people listen to me, but for some strange reason, world-leading professors come on the channel, and in all due modesty, you're one of them. So, Professor, thank you so much for coming on.
John, great as always to talk to you, and
always.
Let me know how you get on with the GABA, all right?
I will. I look forward to it, and I might have one of these tonight as well. Thank you.
Fantastic.
Thank you.